guys, welcome to another episode of Education Through Experience. I have another guest here with us. If you want to go ahead and introduce yourself.
What's up, fam? It's Quadir here, 33, trans man, living it up.
Living it up. And you're in Utah, right?
Yeah, yep, in Utah right now.
See, we've been talking for a little bit, so I know a little bit about him.
Yeah,
But I'm
yeah.
hoping I'm hoping to learn some more today, you know?
Yes, sir.
We're gonna get deeper into that issue you have with your surgery.
Ha, the issue, which one?
Oh yeah, which one? Let's see. Okay, when did you know you were trans?
Man, I knew that I wasn't a girl at like the age of 4.
Yep.
Um, but I never really knew the term trans or transgender or trans male until I was about 16, and that was in '06.
Oh wow. Okay.
Um, so let's just say about '06 when I put transgender to myself.
Okay, that's when it started to click. Like, okay, like maybe this is what it could be.
Yeah.
Okay. And then after, all right, so you realize that at 16, how long after that did you actually start coming out as transgender and then starting your medical transition?
So coming out, I couldn't even say I even came out with, like, I never came out the closet as, you know, a stud or transgender. I've always just been,
Okay.
so I've never was like, oh, hey, this is what I am. I just, it is what it is with me. And I've always had people referring to me as male.
Okay.
So, and what was the second question you asked?
Oh, I said, how long have you been on testosterone?
Oh, since May 28th, 2019.
Okay. Nice. So a little bit, a couple months before me.
Yeah, so I would call myself like a late bloomer,
Yeah.
because I was actually incarcerated for 5 years previously.
Oh wow.
Um, so when I got out in February 2019. I automatically, you know, made those connections happen and got on T right away.
Okay. You spent that time thinking. You was making plans.
Yeah, yeah, I was ready.
And how was that difficult for you? Were you at Utah? Were you in Utah at that time?
I was in Utah. I've been in Utah since I was 16.
Okay.
Uh, and like the whole time being here in Utah is actually really hard. It was actually really tough on me because of the culture is so different.
Right.
Um, I'm from the South. I'm from South Carolina, so being around, people that I grew up with my whole life, and then coming around different dynamics and people, me getting used to new people, it was really, really tough. So I stayed to myself a lot,
Mhm.
and being the type of person that I am, I'm different out here. People look at me as I'm different.
Right.
At the time, it, people didn't know too many black people, so
Right, of course, yeah.
on top of that, and on top of me coming from the South with a thick accent, it there was more things on my plate than transgender stuff.
Right.
So I, again, so
Yeah, because I've been to Utah multiple times, and I think about the only black guys there are the ones that play for the NBA team. You know,
right,
you know what I
the
mean?
NBA team
Yeah,
or the youths, you got the college football teams, you know, like that's really it. But now it's a lot more diverse.
that's good.
So it's not like um I feel like I'm the only one. It's like now everywhere I turn, I can feel somewhat, you know, at peace because I see my own people, and I'm like, all right, I can feel a little more comfortable now.
That's good. And so has has being in Utah, do you feel like it's been hard on you to transition medically? Like, did you have issues finding a doctor to prescribe it to you?
Actually, the crazy thing is no. Like I thought Utah was going to be so complicated,
Hmm.
with things like that because we have Mormons
Right.
who, they don't see things in certain aspects as other people. So it wasn't hard. I actually just called up this place. It's a whole clinic, the Rebirth Clinic, and the doctor, we made an appointment. I went in. She asked me a couple of questions. I signed my life away,
Right.
and and boom, they gave me a shot that very day.
Oh wow, nice.
And yeah,
Are they limited on surgeons out there?
actually, so for top surgery, um, and bottom surgery, actually, I would say, you know, we're limited. We have the University of Utah who they have a whole transgender health program,
Oh, nice.
where they do top surgery. They did my bottom surgery. Um, but I didn't get top surgery at the University of Utah. At the time, my insurance didn't cover for them.
Okay.
So they recommended me to go to the Intermountain Hospital that we have here. It's just like the university.
Mhm.
And I got it done through a guy who actually studied with one of the people at the University of Utah. So it was kind of, I didn't have any issues with either one, but
Okay.
for being limited, yeah, we are.
Okay. And did you have any issues with your top surgery, or how happy are you with your results?
So with my surgery, I had no issues like complication wise or any of that. I actually love my top surgery. The only part is I keloid. So
Oh, really?
I have I have real thick scarring um, on my chest, which like sometimes it's not an issue for me, but other times when it comes to like, because keloids itch,
Oh,
so I'm like clawing at my skin, to
yeah.
try to find that right spot. The doctor that I go to now, who did my bottom surgery, he's also a top surgery surgeon, and
Oh,
he's going to fix it with like the steroid shots,
yeah,
and
yeah.
yeah, and then he'll cut them out and then fix them again. So you know,
Yeah, nice. I had to do that too. I did the steroid injections for a couple different sessions over several months after my top surgery. Because I had two. I had a revision hoping to get rid of like dog ears, but that didn't go well.
but
So the only thing I
you
got from
still
that
got
is,
them.
yeah, I still do sadly. He didn't do liposuction. Sometimes they do that with the top surgery. I didn't get
Yeah,
that. I honestly didn't really even think to like ask about it. Um, which looking back, I guess I should have. But although I still have the dog ears, I do have now like the flat. Even though my scars are thick, they're flat because of the steroid injection. So I guess I'm happy about that.
yeah. I didn't get dog ears, but I do need the liposuction right here on the side.
Mhm.
Um, just a little bit, but I was actually that's what I was afraid of was the dog ears, to be
Yeah,
honest with you. Because at the time I was a real skinny dude, and to have the dog ears on top of being skinny
yeah.
with keloids actually scared me because I knew I was going to keloid. I already knew that, but the dog ears is what I feared the most. And then the pink and brown nipple part is what I feared.
Did you end up with a discoloration in your nipples?
No, actually, my nipples they're all brown. That actually healed first. Like
Okay.
it was weird. My nipples healed so well. Um, the sucky part is like I'm only at like 50% sensation. Um, and I got my top surgery in 2020.
Oh wow.
Yeah.
And is that sensation level across your whole chest?
So across, if I go like underneath my keloid scars,
Mhm.
it feels like tingly.
Yeah.
Like I can feel the tingle.
Mhm.
Uh, the nipple part, um, like you'd have to touch certain parts of it in order to really feel it.
Right. Yeah.
But if I'm actually touching my chest, it just feels normal.
Okay. Yeah, it took me, I would say, quite a few years to get back sensation. I wouldn't say it's like 100% feels like it, normal. But it's
Right.
definitely getting close to that. Yeah, and I definitely still feel like my nipples are a little bit less,
Hmm.
like 80%. Um, yeah, it's definitely weird how the nipples heal. I think one of mine has more of like a bump, like kind of like if you see like a hard nipple, like one of them is like hard,
Yeah.
like, and the other one is like flat.
Yeah. Mine look like it's just like two keloided nipples. Like that,
Oh
that's
wow.
how I feel like mine look.
Um, so let's get into your bottom surgery.
Let's go.
So you had RFF, right?
Correct.
Okay. But didn't you have like a delayed stage? You want to talk about that?
So the way that the University of Utah does their staging, they like to somewhat separate certain things. So if you're going RFF, radial forearm, in stage one, you would get the creation of the phallus, your nerve hookup, burial. Um, you could do scrotoplasty with it, the vaginectomy. If you're doing urethral lengthening, you would get urethral lengthening. Um, the whole nine. The only
Yeah.
thing that they delay is the skin graft
Hmm.
and the glands.
Okay.
Um, and with that, they automatically do Integra for anybody who does RFF. So, you know, it'll be on there for the 3-4 weeks, and then they do your skin graft. So that would be like your stage two. But for
Okay.
me, I I haven't gotten my glands yet. I did get stage two um, skin graft done, but
Mhm.
not the glands plasty yet. We're delaying that because of a couple of complications that came with it.
And you want to kind of explain those a little bit?
Yeah, so I guess I'll start from the beginning.
Yeah.
I had stage one RFF phalloplasty April 3rd of 2023. Well, clearly 2023. Um, and with that, leaving out of the OR, the operating room, they couldn't hear a pulse in my phallus, so
Mhm.
I had to go back into the operating room, which they found I had a blood clot, and then there was some nerve complication with it.
Oh wow.
So they fixed everything, and with coming out of the OR and them not hearing the pulse, it created like a room for dead skin. Like some of my skin started to die.
Oh, I
Uh,
see.
yeah, so it sucked because coming out of that, they put me on. I was actually on leech therapy, so I had like two leeches every hour,
Mhm.
sucking the blood out of my phallus, which was probably about the weirdest thing ever because I
Yeah.
couldn't feel it. I couldn't feel it on my phallus, but as soon as they're done sucking the blood, they completely fall and they'll start like crawling on the side of you or crawling down your
You
leg.
you have pictures of that?
I have one picture, like and I wish I would have took more, but I was out of it. I had one leech on the floor, like it crawled just straight on the floor.
Oh my god.
Um, but the leeches were to like suck all the blood and stuff out, and they had me on what's it called, the heparin, which is the blood thinner. So with that, with them doing the leeches and the blood thinner, I was pooling blood. Like there was so much blood coming out of me
Oh wow.
that like you would think that with all this blood coming out, you would need to put blood back in your body, correct?
Right.
Yeah, no, that's not what they did. I literally, I think I had it on the third, by the eighth, I completely coated. Like
Oh
I
wow.
had no blood in my body. I coded. They said that I was in critical condition with the risk of organ failure or death.
Oh wow.
And at that time, I had to get a PIC line, I had to get an A line, and I had to get 9 bags of donated blood at that time in order to survive. Like it had nothing to do with the phallus.
Yeah.
It was everything to do with the blood that they weren't replacing.
Oh wow.
So as soon as I got all that blood back in my body, like we stopped all the blood thinners and whatever, and I was fine after that. Like I had no more complications after that, but I did have to stay in the ICU for 8 days.
Okay.
Um, and with being in the ICU, you're in that hot ass room. It's like 80 degrees in there.
Oh yeah, and my room was literally like the size of a closet.
See, I couldn't do it. Like my room was pretty big. It was big, but 80 degrees and a bear hugger, like that bear hugger, me and that bear hugger fought every day. Like, and then they were like, "Oh, you're running a fever." Well, I wonder why. You got me in 80 degrees with a bear hugger on. I'm
Right.
hot. First of all,
That's crazy.
like the only thing I got is ice pack to calm me, cool me down. But after that, I spent 10 days in the hospital,
Hmm.
and a couple of trips back to the emergency room and the operating room because I felt like my whole penis was about to fall off.
Yeah. So you
Like
spent
it was,
8 days in the ICU plus extra days just like in a regular room.
yeah,
Oh wow.
yeah. They were trying to keep me, and I was fighting against it. I was like, listen, I know I got good insurance, but y'all ain't about to take advantage of me. like, I'm straight. I'm good. Let me go home. They're like, no, your blood pressure's too low.
Yeah.
Like, oh, no, I don't care. It's y'all's fault while I'm in here.
Right.
So now let me go.
Right. So
But
how was your recovery at home after all those complications? Like, do you think it was harder?
um, so when I got out the first time, I'd say like walking was probably the hardest part because everything is new, everything is
Right.
heavy.
Right.
And it's like, what? Because at first I was like, why is this shit so heavy? Like I used to walk around with a packer on, and it's like, okay, you would think it would be almost the same thing.
Nope.
No,
Nope.
like
It's like 15 pounds.
right, like I'm like, dang, like you're telling me my phallus is that heavy that I'm having to almost try to carry it with 2 hands.
Yeah, for real.
Like the hardest part, the recovery after that, like was just walking. But my vaginectomy site ended up opening.
Oh wow.
Uh, and it like the blood that was circulating in there actually opened it up. And I had this big clot of blood that they had to dig out. Um, so like now it's so much smaller now, but like it was huge, and I had to stuff it every day with
Wow.
saline and gauze. Um, so the first time, and then once you feel like you're okay, then everything starts separating
Right.
because of the hematoma that like right in your pelvic area, and the blood wants to push out. So it made it look like my whole penis was about to fall off.
Damn. Yeah. I mean, I definitely had a little bit of wound separation, but I not as much as you. I think I would be scared that it would fall off.
Yeah, like it was. The doctor said it was holding on by the nerves and stuff that he connected. Like
Wow.
that's what it was hanging on to. And I was like, "Are you serious?" So we went to the OR again, and They washed everything out, cleared out the hematoma, stitched it up, and I thought it was cool. Nope, 3 days later, it's opening up again. So I'm like, damn, I'm like,
Yeah.
tell me my will not hold on to my pelvic area. And I had to go again. Like, I think I went 2 times for the debridgement and washout. And then when they did stage 2, is when they put like 4 different types of sutures to hold it down.
Oh wow.
But now
They're probably doing
it's
extra
done
that time.
sealed onto my, yeah. I wasn't taking it. I was like, listen, if I got to come back in here,
Yeah.
because at this point, you know, when you're going under anesthesia and they're doing
Right.
the IV,
Right.
they weren't able to find like any more place to try to get my blood from,
Oh
like
wow.
to put an IV, because when I was in the hospital the first time, I had no blood, so
Yeah.
my skin turned real thick, and now it's hard to find IVs. So I told him, if I gotta come in here again, I'll just cut it off. I'm so pissed off, cut it off at this point.
Feel like it's not even worth it
But
anymore.
now we're good. It's, exactly, because they were like, "Oh, we're trying to save the phallus." I'm like, "Well, if I'm dead, what's the point of having this at this point?"
Right. Right.
But
Damn, bro.
but now,
Oh,
we're good now. I got no complaints.
that's good. So you see that your wound separation is healing pretty well. You think the stitches took this time?
Yeah, the stitches took amazingly, like on the top. I
Okay.
I still have like a small separation between the scrotum and the phallus, like right in between there.
Hmm.
But it's not something that, I'm stressed out about to
Okay.
where I'm like, oh my God, please fix it, because I know it'll heal on its own eventually.
Right. Yeah. And are you putting stuff on it?
Yeah, he told me not to put the bacitracin on it, but we've been doing like saline and the gauze like in
Okay.
between there to keep it clean and to keep it dry.
Okay. Nice. Yeah. When I had wound separation, I was told to use like Meta Honey. Dude, that shit
Mm.
works like magic. It's like glue.
Yeah, I was using the Meta Honey at first, like for the first wound separation,
Mhm.
but the wounds were so huge that I was
Yeah.
like, no, this little bit of honey ain't about to
Right.
close that like this.
Right. So like looking back with all your complications, um, do you wish you would have like done things differently? Like, do you wish like maybe it was like a different doctor or you went to a different hospital, or do you think it was totally just like maybe the way your body heals, or how do you think about that?
So in the midst of it, I was wishing that I went to a different doctor, like, because in doing my research, I had there was only 2 doctors that I wanted to go to, which was your doctor, Dr. Michael Safer.
Mhm.
I had a consultation with him and everything. He's amazing.
Yeah.
Um, and then for convenience reasons, a doctor here in Utah. Um, so like then in the midst of the complications, yeah, I wish I would have went to a different doctor.
Yeah.
But with me being in Utah and Dr. Safer in Cali, it's like, what if, the same complications happened and I'm not able to get there as quickly?
Yeah.
So I had to think, like, half of me is glad that I stayed in Utah with the doctor that I have, because with the complications, I'm literally like 20 minutes away from the hospital.
Right. Yeah. And that's good. And that's something that you definitely need to consider when having bottom surgery.
Right. And it's like, because for like aesthetic reasons, like Dr. Safer is amazing. Like his results and the way that they look, amazing. Like I would recommend him to anybody.
Yeah.
You know what I mean? Um, but for like convenience reasons and with my wife having to work all the time and stuff like that, like the University of Utah is where I had to be.
Mhm.
And the Dr. Isaac Goodwin is his name.
Okay.
He is actually amazing. Like he cares. He actually studied in with the Bunkie Clinic. So that's where he trained at. So I was confident in him, but with the complications, I think it was mainly how my body healed. But
Okay.
at the same time, I also think it was a lot of the hospital not replacing certain things
Right.
and the complications in the beginning,
Okay.
or stuff like that. So I'm I'm okay with the doctor that I chose, but I still recommend Dr. Safer if
Right.
anybody's looking.
Yeah, I would too, and I have the results to show it. No, see, that was my dilemma too, right? Because he used to be in San Francisco, and that's only
Mhm.
like an hour and a half, 2 hours away from me. So I didn't mind the distance. But after my phalloplasty, he moved down to LA. So I was like, okay, do I should I continue care with him, or should I, use the new doctor at the Crane Center that replaced him? Um,
Right.
and I kind of went back and forth with that. The same thing, like, if I have complications, I don't want to be 6 hours away. Um, but ultimately, I did continue to use Dr. Safer. In that time that I had the issue with the catheter, being like intertwined with my skin, I was like, I need to go to LA right now. And, I had to wait 6 hours to be able to see him. But luckily, he's very available, like he's very personable. Like I have his cell phone number. Like I can call him at 2 a.m. in the morning and he's gonna answer his phone. You know what I mean? So I definitely love him for that and would recommend him as well.
Right. I wish I had my doctor's cell phone number because he'd be sick of me at this point.
You'll be like, dude, what's happening? What's going on?
Right. I gotta go through my chart and it take them like 8 hours. By then I'm asleep. I don't even
Yeah.
need you now.
Right, right. You're like, I done Googled shit. I figured it out.
Right. I'm my own doctor at this point.
So you were talking about your wife. Did you meet her prior to transitioning?
Yeah, so I actually her and we've been together for 6 years.
Oh wow.
Um I met her I actually met her in prison actually.
Oh
So
wow.
it's kind of like we found love, in a hopeless place.
Yeah, love after lockup.
Yeah, exactly. Exactly. And like she's been my biggest supporter ever. Like I couldn't ask for a better supporter
Right.
than her. She's just so aware of I'd say she's more aware of my body than I'm more aware of my own body,
Yeah.
because she'd be like,
Yeah.
no, this doesn't look right. We need to get this checked out.
Yeah.
Why does it look like this? Why does it look like that? And then she'll be in the doctor's office asking him 1,000 questions.
Right. Yeah.
Questions I never even thought to ask him. So,
No, for sure.
it's always good to have, if not a wife, a best friend, or a family member, or whoever, to learn you and your ways. So if something isn't right, they automatically know and they're like,
Oh, for
hey,
sure.
something's not right here. Let's try to get this fixed.
Yeah. That's exactly how it was too with my fiance. Like she was I we started dating like 3 months before my bottom surgery. And that didn't stop her from, being there and helping me. And yeah, like you said, like she was there asking questions that I never thought of. And that definitely helps, having another conscience, having another way of thinking. Because me, I'm just sitting there happy to be getting surgery, where she's having, she has all the questions that actually we need to be answered, and we need to have yeah, I don't know what I was saying with that,
Yeah.
but
No, I got you because I was the same way. I was like, yep, let's get a date. Let's do this. Let's do
yeah,
that. They're
yeah,
all, wait,
right.
there's other aspects to this. I'm like, yeah, yeah, yeah. I don't care. I don't care.
Right.
Just
She's like, well, tell me all the risks and complications. And I'm like, I don't care. I'm getting it no matter what.
right. Like, just put the penis on already.
Right. I like that. So when is your glanceplasty?
I have no idea yet. So I
Okay.
had on the tip of it, it was kind of like, what's it called? Necrosis.
What is that?
It's kind of like where the skin is dead. Um, like it's like black, kind of. You
Okay.
know what I mean? So what he did was he dug it out, and then when I got my skin graft, he actually skin graft the bottom. Um, so we're waiting on that to heal.
Okay.
and then we're going to approach the glandsplasty. Um, so I'll be circumcised soon, hopefully.
Yeah. And it does make a big difference in the way that it looks. I mean, unfortunately for mine, I had my glandsplasty on my stage one. I had everything done the first surgery, but over time it flattened. And I don't know if that's a result of just having everything done at the first surgery and not allowing things to heal and then go back and get it done. Because it definitely flattened, but part of my tattoo is like right underneath the head, so it adds definition, even though
Mhm.
it's not like thick or there's no like indentation that there's like a difference, you know what I mean? As much as there
Right.
was before. So that the tattoo definitely helps. But I've thought about getting it redone. I'm not sure. I don't even know if I want implants, so who knows?
Yeah, yeah. I know for sure I want implants. It's just a matter of me thinking about how my body already heals
Yeah,
to think about that aspect if, when I'm ready to go that route with it.
right. And I think too, like it was hard for me to choose, right? Because like you have the rod and then you have the pump. I've heard bad things about both. So it's like I don't even know which bad one I would rather have. Like,
Right. Right. Yeah, I actually, so when I first started looking at which doctor for phalloplasty, uh there's this, like, I try to talk to people that are in my state that have already gone to these doctors,
yeah.
and there was this guy that I talked to, and I actually still talk to him now. He's actually scheduled for the implants.
Okay.
And so I've been blowing his inbox up, asking him about, certain things, and, like how he feels about them or whatever. But he's
Yeah.
scheduled, I think he said he's getting the pump.
Okay.
And then a few other guys that I spoke to that have um, the the pump or whatever, they 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 like it to a point,
Mm.
because I think it's mainly the fear of the longevity of
Yeah.
it,
Yeah.
and, oh, do I have to go through this again, or is this thing gonna break while, I'm doing this or that, or you know what I mean?
It's gonna be all you're
I
gonna be on the sex led me to the ER show.
literally, like, it's crazy how, like, just something so simple can be so complicated, but it makes a big difference in certain
Yeah.
things. Like, without the pump, you're so soft with it, and especially the scrotum. Like, my scrotum looks like two little chestnuts right now. You know what I mean? Like, I'm pretty sure with the little implant, it'll make a world of difference. I'll
Yeah.
actually look like a grown man down there instead of, like a fucking baby.
Yeah.
You know?
Yeah.
Sheesh.
The only thing with that I'm worried about is um like it being uncomfortable. Because
Yeah.
I sleep on my side and stuff, so I already have to like use a pillow since like after the surgery. So I'm just concerned that getting like even if I don't get a rod or a pump, but just getting like the testicular implants, them
Hmm.
being like too big, like even if I get the small ones, them being like too big as to where they're uncomfortable.
Right. Especially with them sitting where they sit. Like, even now, I have a hard time trying to find a comfortable position of sitting. And just like you, I have to sleep with a pillow, like right in between my thighs, because I sleep on my stomach, but since I can't sleep on my stomach, I got to sleep on my side,
Right.
and I end up on my back anyway. So regardless, you know, so maybe one day.
Yeah, maybe one day. I'm hoping to find something else,
Mhm.
like an external thing. But I'm still looking. My search hasn't been that long, so hopefully I find something soon.
I know. I just seen your. I think it was the video before the one you just made, where you found those things on
Oh yeah.
Amazon.
Yeah, yeah,
Yeah, I actually, my wife is like, she looked in the Amazon cart. What is this? I said, don't worry about it. Don't worry about it. We're still doing some research here.
yeah, yeah. So I'm gonna tell you, I haven't made a video about it, but I did try it on. So
Uh-huh.
it definitely is hard enough. The thing is, I think I'm too close from my last surgery that I'm worried about like squishing it too much. So I think I'm gonna give it more time because that shit and like squishes it down.
Mm-hmm.
But it definitely will work. Those $10 will
Okay.
be worth it.
All right. All right. All right. Yeah, because like even now, I even squeezing it, like, because I'm still somewhat swollen, so like squeezing it.
Mhm.
If something like that was on me and it squells, my wife was like, "What the hell is blood coming out of the
Yeah,
tips?" Like, what
yeah,
the
yeah,
hell?
yeah. Yeah, no, I put it on and the tip got red real quick. I was like, okay, take it off real quick. Take it off. Try again next week. You know what I mean?
Yeah, yeah, that's funny.
All right, bro. Well, we're running out of time. I think we should definitely schedule another video so we can talk a little bit more about your transition and your journey, and if you have any questions for me. But in the last like 2 minutes, if you have anything to say or anything to promote, go ahead.
I'm gonna wait till the second part for that.
Okay. Okay.
I'm gonna leave everything to the imagination, anticipation.
Okay. Okay. We'll just leave it at I like your shirt and sucks for the Lakers last night.
Yeah, I actually made this shirt.
I love
Uh,
it. I'm
you
gonna need
know,
one of those.
and I got you. You know, and shout out to my boy LeBron. You
Oh,
know what I mean?
yep.
Let's hope he comes back next year. So,
Yeah. Yeah.
yep.
All right, bro. Well, thank you so much. Hope to talk to you soon.
All right, my man, I got you.
All right, peace.
All right.